Hello everyone, I hope you are doing great. So today we'll be discussing about the rest of the skull that was left, that is the superior view and the inferior view of the skull, right? We'll discuss the base of the skull in the next lecture because it's a bit detailed view. So firstly, if we talk here about the superior view of the skull, you should know that there is a presence of only a few bony landmarks. That is, here is the presence of the frontal bone, this is the parietal bone, and here is the occipital bone, right? So the frontal bone, it is actually going to be attached with the parietal bone with the help of a suture, and this suture here is called as the coronal suture. If you can see, this suture is called as the coronal suture, right? And then between the two parietal bones, there is the presence of the sagittal suture. This is called as a sagittal suture. And between the parietal and the occipital bone, there is a presence of the lambdoid suture. So you should keep in the mind that this is actually the skull, the superior view of the skull of an adult. But in the case of the neonates, there is a different diagrammatic representation. If you can see here, in the case of neonates, there is a presence of the fontanelles, right? This is the interior fontanelle and this is the posterior fontanelle. And why is this so in the case of the infants or the neonatal skull? The reason for this is, basically that the brain, they need to grow, and if the skull is so small, this skull will not allow the if there is no fontanelle in the case we're discussing, right? If there are no fontanelle and the skull is having a complete suture at the time of birth, so of course the brain, when the brain will grow, the skull won't be able to accommodate that, right? So it's been made in such a beautiful way that when the baby is going to grow, there will be an increase in the structures of the body, and this fontanelle is here to allow the accommodation of increase in the size of the brain, right? So and also this is also going to allow the passage of the baby during the labor delivery, right? So the interior fontanelle that is present here, it is actually a diamond shaped structure. This, you can see, is a diamond shaped area and is going to close in about like 18 months of the age, right? And the posterior, this interior fontanelle, to be remembered, the interior fontanelle is also called as the brygmatic fontanelle, right? And the posterior fontanelle, that is actually a triangular area and is called as a lambdoid fontanelle. Why so? Because it's area of the lambdoid suture. So this is going to close by the first year of age, like till 1 year or so. So this is important bony landmark, clinically also very important. After that, we'll be discussing about, yeah, we were seeing here about the fontanelles, and this is only the superior view that you should learn. So for the vault of the skull, we discussed about the superior part of the skull, but we should also know about the internal structure, right? This was basically the superior view of the vault of the skull, and if we talk here about the inferior view of the vault of the skull, so it is only going to contain a few important landmarks that you should know properly, right? Firstly, there is a presence of here a groove. You can see this is a major groove, the major groove for the superior sagittal sinus. This is actually a groove for the superior sagittal sinus, right? What is a superior sagittal sinus? Superior sagittal sinus is here. You can see this entirely a venous sinus that is going to drain the blood, right? So this is here the presence of a groove for the superior sagittal sinus on the vault of the skull and the inferior surface of the vault of the skull. There is also the presence of the some of the groove or for the arachnoid granulations, right? And this is actually, you should know about the arachnoid granulations present in the cerebrospinal fluid circulation. And here is also the groove for the middle meningeal vessels, right? The arteries and the veins, they're going to pass through this area, forming a groove in the vault of the skull. So this was entirely the vault of the skull, the superior view. We discussed about the superior view of the vault of skull, the inferior view of the vault of the skull, and also we discussed about the how this is present at the time of birth, and later on when the baby is going to grow, these fontanelles will become closed and they'll become the sutures, making the coronal suture, the sagittal suture, and the lambdoid suture, right? Next, we will be discussing about the inferior view of the skull, that is more likely to be related with the internal part of the skull. There are the different foramens and different structures present here, allowing the passage of the different nerve in the vessels, right? So firstly, we'll be talking here about the superior surface. If you can see, this is superiorly. The base of the skull is going to consist of here the hard palate, right? The upper surface is made up of the hard palate, and the hard palate is actually made up of the two bones, right? If you can see, this is the maxillary bone. The green bone entirely is the maxillary bone. As we have already discussed in the norma frontalis lecture, that the maxillary bone is divided into the different bones. The one that is going to be in contact with the zygomatic bone is going to make the zygomatic process. Here is the presence of intermaxillary suture that was also present in the interior view of the skull. And now we'll be discussing about the third part of the maxillary bone, that is actually the palatine process of the maxillary bone, that is going to make the inferior surface of the hard palate. Like you can see, the interior two-thirds of the hard palate, it is made by the palatine process of the maxillary bone, right? And this is also, here is a structure called the incisive foramen. The incisive foramen, it is going to allow the passageway of the nasopalatine nerve, and along with that, the anastomosis of the posterior septal branch of sphenopalatine artery and the lateral palatine artery is going to take place at this foramen, right? So this foramen is clinically also very important. You should remember that the incisive foramen allows the passage of the nasopalatine nerve, right? On the other hand, the posterior one-third of the hard palate, it is made up of another bone, that is actually the palatine bone. The horizontal plate of the palatine bone is going to make it up, right? In the similar way, like the incisive foramen or incisive fossa, and there is also the presence of the two foramen that are actually the greater palatine foramen. If you can see this greater palatine foramen, and the greater palatine foramen actually allows the passage for the the greater palatine nerve and vessels, and the lesser palatine foramen is also present in this location. There are one or two of the lesser palatine foramina that are going to allow the passage for the lesser palatine nerve and vessels, right? So we discussed about the interior structure, that is the hard palate containing the two basic bones, the maxillary part, that is the palatine process, and the horizontal part of the palatine bone, right? When we move here posteriorly, there is a presence of the vomer. You would have remembered this bone vomer that we discussed in the anterior view of the skull. This vomer makes the lower part of the nasal septum. If you can see, this is the vomer, right? The upper part of nasal septum is made by the perpendicular plate of the ethmoid, and the lower part, it is basically made by the vomer, right? So the vomer is going to make the nasal septum, and that is also being shown here. After that, this yellow bone is a sphenoid bone, right? And the sphenoid bone is contain many parts, with the greater wing of sphenoid and the lesser wing. But here we're discussing about the inferior view of the skull. In the inferior view of the skull, the sphenoid bone is going to contain, this is the medial pterygoid plate, right? The pterygoid plate will be divided into the medial pterygoid plate and a lateral pterygoid plate. The medial pterygoid plate is going to extend upward, forming a hammer-like extension called as the humulus, and between the vomer and the medial pterygoid plate, here is the presence of the choana, right? And this is going to take it into the nasal septum, so that is going to lead to the nasal cavity, right? Between here, we can see the medial pterygoid plate and the lateral pterygoid plate is the presence of the scaphoid fossa. This entire fossa is called as the scaphoid fossa, right? And after that, if you can see, in the greater wing of the sphenoid is also the presence of the two foramen, that is actually the foramen ovale and oval foramen, and the foramen spinous, right? A very tiny foramen. If you can see the foramen ovale allows the passage for the lesser petrosal nerve and the mandibular division of the trigeminal nerve. That is actually the third branch of the trigeminal nerve. The trigeminal nerve is going to contain the three basic branches: the mandibular division, the maxillary division, and the ophthalmic division, right? So the mandibular division of the trigeminal nerve, that is the third branch, is going to pass through the foramen ovale, right? In the base of the skull, we'll be discussing about the different foramens and what are they going to allow the passage of. So here is the mandibular division of the trigeminal nerve. The foramen spinosum is also present, and this is going to allow the passage of the middle meningeal vessels and the meningeal branch of the mandibular nerve. But we should remember only the middle meningeal vessels, right? After that, we'll be moving towards the temporal bone. This is the temporal bone. As you know, this is the zygomatic process of the temporal bone that attaches with the zygomatic bone, making a zygomatic arch, and this is the presence of the mandibular fossa and the articular tubercle. The mandibular fossa is going to allow the attachment of the condyle process of the mandible, making a temporomandibular joint, right? This is the styloid process, this entire, and the mastoid process. Apart from that, this is the carotid canal, external part of the carotid canal, and the carotid canal is going to allow the passage of internal carotid artery and the internal carotid plexus as well, right? After that, you can see here is the presence of a mastoid notch, a very small this is the mastoid notch. A mastoid notch is also present here, and the mastoid foramen, this is actually the mastoid foramen here. The mastoid foramen, actually this was the mastoid notch, and this is the mastoid foramen. The mastoid foramen allows the passage of the mastoid emissary vein and the posterior meningeal artery. Very important to note that the mastoid foramen allows the passage of the posterior meningeal artery, right? Then after that, you could see here, this is a groove for the jugular fossa. This is the jugular fossa, and the jugular fossa allows the 9th, 10th, and 11th cranial nerve, that is the glossopharyngeal nerve, the vagus nerve, and the accessory nerve is going to pass through this jugular foramen to the exterior, from the interior of the skull to the exterior, right? Then we will talk about the occipital bone. The occipital bone is going to contain, here is the foramen magnum, a big foramen magnum that is going to allow the passage of the medulla oblongata, the vertebral arteries, and the venous plexus, along with the spinal root of the accessory nerve. And here is also the presence of this is the occipital condyles. The occipital condyles is going to allow the attachment for the atlas, that is the first cervical vertebrae, that allows the movement of the head in the different directions. And this is the hypoglossal fossa, the hypoglossal canal, that is going to allow the passageway of the hypoglossal nerve, right? Then here is the presence of the pharyngeal tubercle, and this is actually the external occipital protuberance that can be seen in the posterior view of the skull. The external occipital protuberance is going to go downward, forming the inferior nuchal line, and laterally the two parts are going to extend, forming the superior nuchal line. And here is the presence of the foramen magnum. So we discussed about the most important things, and yet I'm left with one thing, that is the stylomastoid foramen. The stylomastoid foramen here, this is the stylomastoid foramen, and just above the mastoidal notch is a stylomastoid foramen that allows the passage of the facial nerve, right? So this was entirely about the base of the skull and the important structures that we discussed. What are the contents of the different foramens and different fossas, and it is very important for the OSPE point of view as well. So we discussed about the different bones and all the structures. In the next video, we'll be discussing about the different the base of the skull, the anterior cranial fossa, middle, and the inferior cranial fossa, and the different contents, what the different foramen is going to allow to pass through the actual skull, and it will be a very interesting video. I hope you all like this video because it was a very comprehensive one for the OSPE examinations and also for the osteology section. So if you like it, just subscribe and share. Thank you so much.